Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 8 risk factors and causes for Achilles tendonitis. It's very important to understand those risk factors because when you avoid these risk factors, you will decrease your risk of having Achilles tendonitis. Or understanding those risk factors and eliminating them will help you to relieve some of your symptoms. The first cause and risk factor for Achilles tendonitis, and usually is connected with other causes, is a sports injury. And that's usually happen from overrunning, jumping, tennis, basketball, any impact sports that require repetitive impact could cause Achilles tendonitis injury, especially if you have tight calf. That is actually connected with the cause and risk factor for number 4. So if you have tight calf or hamstrings, that could lead to Achilles tendonitis because you cause poor body mechanic in your foot and could cause injury to the Achilles tendon. So sports injury, the second cause and risk factor, it's usually more common with men. And the third cause and risk factor is running in worn out shoes. So shoes is extremely important, and I will talk about it in another video. If you're wearing a shoes that poorly designed, and that's actually the majority of the shoes in the market are poorly designed, will increase your risk of having Achilles tendonitis, plantar fasciitis, other foot issue. So poor design shoes or worn out shoes, especially if you put more mileage on your foot, like with the sports injury, with the sports activity like running, jumping, that increase the risk of having inflammation in the tendon of the Achilles here and trigger or cause the Achilles tendonitis. The fourth cause is tight calf, and that's extremely very common. The patient I treated for Achilles tendonitis, they always have very tight calf that actually pulling, causing excessive pressure on the Achilles tendon here, and could lead to micro tear in the Achilles tendon and cause the Achilles tendonitis. So tight calf is extremely very common with those patients. You can get tight calf from poor foot biomechanic. You could get tight calf from poor shoes, high heel, or poorly designed shoes will cause your calf to be tight because you work in your calf more, so you're straining your calf, and that's a cascade risk factors for Achilles tendonitis. The fifth cause for Achilles tendonitis, bone spur, and that's usually occur in the area of the calcaneus bone, and I can show it to you here in this model. So we have the foot here, you have the calcaneus bone, and this is where the Achilles tendon to attach here and going all the way up to your calf muscles. So when you have Achilles tendonitis, you usually have inflammation, fibrotic tissue in Achilles tendon here. When someone has a bone spur, especially around in the calcaneus bone, that could cause inflammation and pressure and poor biomechanic in the ankle area that will cause a strain on the Achilles tendon and cause Achilles tendonitis. So poor shoes, calf tightness, very common risk factor and causes, and that will lead to bone spur, which actually could cause more symptoms with the Achilles tendonitis. The sixth cause or risk factor is excessive foot pronation and supination, and you can see it here in this image. The middle image, that's when your calcaneus bone is aligned perfectly with the calf muscles. You can see that blue line. And when you have pronated foot, you basically, when you look in the back and you draw an imaginary line, you will see this angle. And also you will see in this area of your foot is just more sticking out. So it's going this way, so actually your arch of your foot is collapsing. That's a risk factor. That's actually cause more strain, more pulling on Achilles tendon, and cause Achilles tendonitis. In the future, I'm going to go over some exercise we can fix that issue, but that's a very common risk factor. Pronated foot or supinated foot, which is actually the opposite direction of the foot is going outward, which is actually causing more arch and plantar arch, and that will cause more strain on the Achilles tendon. And you can see it here, it's excessive angle in this direction. That's a supination. So those are actually very common risk factors. The other less common risk factors, but it occur for a lot of patients, is when you have disease like psoriasis or high blood pressure. The eighth risk factors is taking medication like antibiotic. I will leave a link underneath this video for 9 ineffective treatment for Achilles tendonitis, so you don't have to waste your time and money on those treatments. And also I will leave a link for the 3 most powerful effective treatment for Achilles tendonitis. If you have any question or comment, leave it in the comment section. I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.